The next anxiety disorder is called post-traumatic stress disorder. Up to 70% of men and women will experience a traumatic event, either natural or human causes throughout their life. But believe it or not, most people will in fact cope. Up to 8% will develop post-traumatic stress disorder, and 40% will never recover. That one incident, that one traumatic experience, those who are really affected, 40% will go on and experience those symptoms for the rest of their life. PTS does not cure alone. 79 to 80% will go on to develop another psychiatric disorder, and the most common psychiatric disorder is indeed depression. And this is important, the definition. Post-traumatic stress disorder develops when one experiences, witnesses, or confronted by an event or events that involve threatened death, serious injury, or threat to the physical integrity of self and others. The trauma causes intense fear and a sense of hopelessness. They're very disabled during that time. And they must, for the diagnosis, they must have re-experienced things. They must have flashbacks, dreams, and thoughts about the events. They avoid the situation. They avoid talking about the situation. They avoid returning to the scene. And they're hyper-aroused. They're always concerned that something might happen to them. And the symptoms must persist for more than a month. The most significant difference, now, when a trauma immediately occurs, they develop what they call an acute stress disorder. This must occur before the diagnosis of post-traumatic stress disorder can be given. And what do they have? They have numbing, they have derealization and depersonalization. They feel they're there but not there. They're the major core features of this, and they often have forgetfulness associated with the incidents. And they're just numb, they're just dead. And so the body's reaction to the body's in fact protecting itself. And recently I had a person who was a beautiful girl, 18, 19 years old. She was getting off a bus and was assaulted. She was pulled down to the ground, she was bashed, and she was hit. And she developed acute stress disorder and really was just so frightened. And she had no sense of feeling, and she was just unable to recall the event. And over a period of time now that the acute stress disorder has dissipated, and she's got a few minor symptoms of post-traumatic stress disorder. Why do I tell that story? Once again, it enhances my point I'm getting across tonight of early intervention. We intervene with this girl quickly. Who's at risk for developing post-traumatic stress disorder? Prior exposure to trauma, those who have a prior psychiatric history, family history of depressive illness and anxiety, additional stress at the time of the trauma, females twice as likely as males to do it, a history of childhood sexual abuse, and early separation from parent can also influence the risk of developing the disorder. Now, I think it's important to recognize that post-traumatic stress disorder can occur across the age spectrum. Children, adults, and in later life. And we should never forget children who are exposed to trauma, because their brains are so vulnerable, as I turned to talk to you before, that they can have lasting effects throughout the whole life. And I'm not sure that childhood bullying, physical and emotional, for the young child is not, it can perhaps be considered as a traumatic event, having primary symptoms, primary changes on the brain. And of interest, there's been some studies of brain functioning now come out of children who have been physically abused, and certainly they've got changes in their brain, and I suspect many of them will be chronic throughout their life. Sexual abuse has a similar effects. Children who are chronically abused or even abused once can have major changes to their brain which are lifelong and lasting for them.